Back to Morning in America. Deaths of pregnant women and those just having given birth have more than doubled in the U.S., according to a study published this week in the Journal of the American Medical Association. Researchers looking at maternal deaths over 2 decades, from 1999 to 2019. Those deaths that occurred during pregnancy or up to a year afterward is what has doubled. And it's very alarming to researchers. There are disparities. Black mothers dying at a higher rate, the highest in the country. For more on this, we're going to bring in emergency medical physician Dr. Richina Bicette. I was just told how to say your last name. Is it Bicette-McCain?
It sure is.
Dr. Richina Bicette-McCain. It's very important to get people's name right. It's like the first compliment you give them. Thank you for being with us.
You're welcome.
First off, how has our perception of pregnancy and a healthy pregnancy changed in this country? Has it? Have people changed the way they view, oh, it's just easy? My mom would say, she's had 7 kids. Oh, having a baby's easy. Has that actually been different for a younger generation?
I think it has. I think that a lot of us are aware of the risks that are associated with pregnancy and childbirth, especially with there being so many high-profile, prominent stories. We've heard about Serena Williams' birth story and how she had a pulmonary embolism and felt that she was ignored. We've heard about other maternal deaths that have occurred at high-profile hospitals that could have potentially been prevented from hemorrhages and other postpartum conditions. So I do think that the healthy, easy pregnancy is a thing of the past.
Why? Why is it a thing of the past? What's changed, especially as we have advancements in technology, and what are women dying from?
Adrienne, we've actually seen maternal mortality rates rising since 2018. However, it was during the pandemic in 2021 that there was a sharp uptick, almost a 40% increase in maternal mortality rates. And of course, COVID is partly to blame. There was a famous paper published in JAMA in February of this year that showed that maternal morbidity was 2.5 times higher if you contracted COVID. That paper also showed that maternal mortality rates were 14 times higher amongst pregnant women with COVID. So we do know that the pandemic plays a large role, but that is not the only thing going on here, I think, Adrienne.
What's going on? I mean, just this month, we have the Pregnant Workers Fairness Act enacted, allowing for longer breaks for women, shorter hours at work, or time off for medical appointments and recovery from childbirth. This is all under the EEOC. You mentioned COVID. Clearly, this is partially a health issue and a mental health and stress issue. So how much could this new this new pregnancy act help?
Well, I'm hopeful, but I don't think we're going to see the results of that for a few years. The act was just passed in 2021. So thankful that President Biden is raising awareness and putting focus on the issue. But honestly, when you look at the disparities, the racial disparities that exist, Black mothers are dying at 3 times the rate of white mothers. For the first time during the pandemic, we've seen the maternal mortality rates for Hispanic mothers become higher than that of white mothers. And so those racial disparities have to make us address what the cornerstones of the issue are. And those are implicit bias and institutionalized and structuralized racism.
Okay, and I'm sure there are some people at home saying it doesn't make sense. They don't believe that it's as systemic as some doctors are crying out and saying it is. Is there anything happening in the areas of training and education to prepare mothers and to prepare medical professionals for some of these statistics so that we can improve the numbers?
We're trying as best as we can through our diversity and equity and inclusion initiatives. But for some reason, although we are just attempting to broaden access to healthcare and provide equitable access to healthcare to all races, all genders, it seems to be such a political issue, such a hot topic, that there are a lot of parties who are opposed to diversity, equity, and inclusion initiatives. And that's where it starts, with education.
Well, and I think, too, there are people who say maybe this is something that goes to the healthcare of mothers, what they're doing to prepare themselves for pregnancy. Is that something that needs to be addressed culturally in the community where there's broader education? As you said, it's not like my mama's day of having a baby and it's just as easy as popping out pumpkin seeds, as she used to say, which I thought was very funny. Dr. Bicette-McCain, thank you so much for joining us.
Thank you for having me, Adrienne.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.